Hey, this is Mrs. Reichelt, and our next video we're going to go ahead and talk about how urine forms as well as the characteristics of urine. So the urine formation occurs in basically three different steps. So the first step is the glomerular filtration. Basically, and the definition is right down here if you're wanting to write it down, but basically here you have water and solutes and other small proteins that are going to be forced through these capillary beds in order to then be filtered out or reabsorbed back into the bloodstream. So we're having a lot of materials filtered into this glomerulus to either be reabsorbed into the body or secreted to get rid of. The second step is tubular reabsorption. Reabsorption is all the stuff that's good. So this is going to be like your body wants to hold on to its water, it wants to hold on to its glucose, amino acids. It's going to keep all of that. So that means that those materials, the stuff that your body needs, will be reabsorbed into the body. And then the last step is the tubular secretion. This is going to be all the stuff that your body no longer needs. So it's going to be things like creatine and potassium and nitrogenous waste, those sorts of things. So three major steps of urine formation. So the first one, the glomerular filtration, is a non-selective passive process. That means anything and everything is going to wind up there. Water, solutes, and small proteins will be forced through the capillary walls. Proteins, blood cells, are normally too large to pass through the filtration of the membrane. So if it's really small, then it'll pass through these capillary beds. If not, they won't be filtered there. They'll basically have to go to the spleen or the liver or somewhere else to get out of the body. And then filtrate is collected in the glomerular capsule and it leaves through the renal tubule. Tubular reabsorption, again, is all of the stuff that your body is going to keep. So it's going to be the reabsorption of the useful substances, I would say, is your biggest takeaway here. These are going to be things like water, glucose, amino acids, ions. Some of your reabsorption is passive. Most of it is active transport. That means you're going to utilize ATP. And then most reabsorption occurs in the proximal convoluted tubule. So the PCT. Remember, there was that Bowman's capsule here, and then you had the, so if this was the Bowman's capsule, then you had the proximal convoluted tubule, and it was kind of all over here. Then you went down to the loop of Henle, then back up through the distal convoluted tubule to the collecting duct. So the collecting duct was here, but the proximal convoluted tubule is up there at the top. All right, so here's a better diagram here. So the tubular reabsorption, these are the materials that are not reabsorbed. These are going to be things like nitrogenous waste products. So urea is from protein breakdown. Uric acid is from nucleic acid breakdown. And then creatine is associated with creatine metabolism in muscles. Remember we talked about creatine phosphate in several videos ago, but creatine phosphate basically breaks apart into creatine plus phosphate, and that phosphate adds from ADP to you add a phosphate and then you make ATP, and then you get energy without having to go through cellular respiration, which is great news, except for the creatine can't be broken down by your body, so it's going to be filtered out in your urine. So here's just a diagram of kind of what this looks like. It's trying to tell you what is active. So your active transports are going to be shown in red. Don't go ahead and memorize all of these. Just be aware that materials are going to be moving in and out. Some of them are going to move actively. Some of them are going to be moving passively. An example of passive transport is going to be water. Okay, let's see. So the reabsorption in reverse, some materials move from the peritubular capillaries to the renal tubules. Hydrogen and potassium ions, creatine, so all the stuff you don't want in your body. This process is really important for getting rid of substances that are not already in the filtrate. And then materials left in the renal tubule will move towards the ureter. So remember, you go from your kidney structures, and then your renal tubule is right here. And then it's going to attach to the ureter, and then to the bladder, and then to the urethra. So we're on our way. We're just getting to the ureter right here, which will attach to the bladder, which is the storage tank. So some of the major characteristics of urine: in 24 hours, a person produces between 1 and 1.8 liters of urine. Urine and filtrate are different. So filtrate contains everything that blood plasma does except for the proteins. You might want to be aware of that one. Urine is also what remains after the filtrate has lost most of its water, nutrients, and necessary ions. So think of urine as being much more concentrated compared to filtrate. And then urine contains nitrogenous waste and other substances that are not needed in your body. Some more characteristics of urine. Make sure you're aware of the things that should be found in urine and the things that should not be in urine. So things that are not normally found in urine. Glucose, if you do have if you have a lot of glucose in your body or in your urine, they'll probably see if you have diabetes. Blood proteins, if you have blood proteins or red blood cells or hemoglobin, it's likely that you'll see a little bit of pinkish or reddish in your urine. And then white blood cells or pus should not be found. The presence of white blood cells means that you have some sort of infection. Okay, and then red blood cells tends to mean that you're bleeding somewhere along your urinary system. And then bile should also not be. Bile, remember, is going to be produced in your liver, stored in your gallbladder, but bile should not be in your urine either. So your yellow coloring of urine is due to a pigment, and basically as you have the destruction of hemoglobin, that turns into this urochrome, which is a yellow pigment. Urine is sterile, so if you've ever heard, I always get questions every year about what if you got stung by a jellyfish in the ocean and you needed to clean it off? Could you pee on it? So the answer is yes, because urine is sterile. It is slightly aromatic. The normal pH of urine is about 6, and it has a specific gravity of between 1.001 and 1.035. Probably don't need to remember that one, but it's kind of a fun fact there. Some more characteristics of urine. These are the things that are actually found inside of urine. So sodium, potassium, urea, uric acid, and creatine, ammonia, and also bicarbonate ions as well. And then here are some abnormal urine structure, conditions here. So if you have an abnormal amount of glucose in your urine or protein, it'll be some of these other ones here, and these are the possible causes. So we talked about glucose specifically, which would be an indicator of diabetes. So there's a couple of others, and that basically wraps up the contents of urine, and I hope you found that helpful.